Why is integrated care needed? Currently, over 24 million people in the United States are battling mental illness and going untreated. That's almost the entire population of the state of Texas. In fact, 56% of adults with mental health issues are not currently being treated, and over 62% of youth will never receive the life-changing treatment they need. Mental health disorders are a silent epidemic in this country, slowly ruining people's lives, fracturing families and relationships, causing run-ins with the law, bringing about job loss, and costing the U.S. economy over $193 billion in lost wages every year. Additionally, current service providers are disconnected and fractured with very little collaboration. This leads to huge gaps in service, poor potential outcomes in treatment, and an all-around frustrating experience for anyone seeking care. In short, the current system is broken. And if the system is broken, how can you expect it to fix you? Your day starts like this. Your alarm goes off for the 7th time and you still can't get out of bed. You're tired, you're irritable, you're depressed. You find yourself arguing with people over pointless things. The workplace chokes you. You can't focus. Maybe you take something to ease the pain. Maybe you drink a little more than you should. After all, just to help you sleep, right? Then you wake up the next day and do it all again. The alarms, the irritability, the depressing arguments, the slow downward cycle. Maybe you lose your friends. Maybe you lose your job. Or maybe you end up in jail. Get help, a loved one tells you. You've probably tried. You called a healthcare provider, but you couldn't get an appointment for weeks. And in that, you're not alone. 96 million Americans report having to wait over a week for care. Worse, none of the providers you called would work with your schedule. A weekend visit? Yeah, right. And what about all the different people you have to talk to get the treatment you need? Sometimes it feels like the worst kind of obstacle course. A clinician may assess a client and make a treatment recommendation, but will not provide a psychiatric diagnosis. A psychiatrist may provide an accurate diagnosis and supervise medications, but will not engage in ongoing therapy. A therapist might provide individual therapy, but may not offer group or family sessions. While each of these steps in the treatment process is important, offering them separately creates a burden on clients who may need access to care from multiple agencies and providers. It also creates a disconnected system that doesn't allow each of these providers to communicate and work together to provide the best possible care. When finding the right care becomes a bigger burden than the burden you're actually living with, what's the upside? It's just easier to go back to old habits. Why not? There's no way out. But what if there were a way out? What if there was a path to better care? What if there was a path that could lead you to treatment, a path that helped you solve the problems you face and eliminated the barriers you run into so you can get the care you need? What if there was a service that responded to your needs immediately and could guarantee an appointment in 3 days? What if a care professional could visit you in your home or your community? What if this service could meet you on your schedule? And what if they could even see you on the weekend?
Hey there, how's your Saturday so far?
The weekend, yes. Right. Integrated care is the path you need. Path Integrated Healthcare, or the PATH, is an organization that specializes in providing high-quality, innovative behavioral health and substance abuse treatment via strength-based solutions and positive approaches to care. At the PATH, all providers are connected within one system of care. This integrated system ensures direct communication that allows for each step of your treatment process to build upon the previous one. It also eliminates the challenge of scheduling multiple appointments with multiple agencies each time you would like to receive services. Different from providers who only focus on 1 or 2 central services, the PATH removes potential obstacles to treatment by committing to a policy of zero barrier care. What is zero barrier care? Simply put, zero barrier care is our commitment to you that we will do all that we can to make sure that you get the help that you are seeking. Regardless of age, regardless of schedule, regardless of location, we're here to help. Anyone, anytime. The PATH allows clients to access a full continuum of care options that are designed specifically to meet all of your individual treatment needs. Integrated care has been proven to improve your access to care, your wait times for care, and your quality of care. It has reduced overall length of care and helped clients achieve autonomy much sooner. A large hospital system in Tennessee recently committed to an integrated system of care, and in the first year, they decreased psychiatric visits by 27% and reduced emergency room visits by 48%. 90%. Integrated care also contributes to better outcomes for you. According to the Substance Abuse and Mental Health Services Administration, integrated systems of care directly contribute to lower costs, reduced substance abuse, decreased symptoms, better independence and functioning, fewer hospital visits, greater housing stability, and a significantly improved quality of life. Free yourself from the cycle of substance abuse and find solutions to improve your mental health by visiting pathihc.com.